Hello everyone. Today I am presenting another learning case from Department of Radiodiagnosis. This case was presented by Dr. Hina, senior resident from our department in Orthopedics Radiodiagnosis Pathology Interdepartmental Meet. However, the video recording is done by me. As per the clinical history, 20-year-old female presented to us with swelling in the dorsum of the right wrist since 4 days. There were pain in multiple joints since 2 years on and off, inability to completely flex the fingers of the right hand. On seeing the old investigations done outside, ESR was 24 mm per hour and RA factor was negative. This was the clinical picture of the patient's hands, which showed that there was swelling over the dorsum of the wrist. The patient was referred to us from the orthopedic department for radiograph of wrist AP and lateral views and for ultrasound of the right wrist swelling. Old investigations, none available. The modalities done here were X-ray right wrist, AP and lateral views, and ultrasound right wrist. So these were the AP or the DV and the lateral radiographs of the wrist joint of the right hand, which showed that there was soft tissue opacity seen over the dorsum of the hand, which was projecting laterally near the radius on the AP view. Also, on closer inspection, it was found that there were erosions over the scaphoid bone and the distal radius laterally, as well as there was a suspected erosion over the triquetrum bone. So these were the radiograph findings, which I already explained. On ultrasound, it was found that along the tendon of the extensor carpi radialis longus, there was proliferation of the synovium, diffuse proliferation, which was surrounding the whole tendon in the axial view. On color Doppler, on optimizing the image, it was found that the tendon showed increased vascularity, and there was also increased vascularity in the diffuse synovial thickening. The other pictures of the ultrasound. So on ultrasound findings, we reported that there was hypoechoic diffuse synovial thickening around the extensor tendons of the wrist. And however, the echo pattern of the tendons was normal. There was increase in vascularity noted around few of them. Similar findings were noticed around the tendons of the flexor compartment, predominantly the flexor digitorum tendons at the level of the heads of the metacarpal. There was cortical irregularity also noticed at the second metacarpophalangeal joint. However, the contralateral wrist showed no significant abnormality. After considering and correlating the clinical history, final diagnosis given from our department was that of rheumatoid arthritis because there were multiple joint involvements as well as there was increased vascularity in the synovial thickening, thus suggesting the patient had an inflammatory pathology. On reviewing the literature, for evaluation of patients with rheumatoid arthritis, few of the studies have said that a minimum of 7 joints should be evaluated, which involves the dominant wrist radiocarpal joint, second and third metacarpophalangeal joints, proximal interphalangeal joints of index and long finger, that is second and third finger, and second and fifth metatarsophalangeal joint of any feet. It has been found in few of the studies that usually second and fifth metatarsophalangeal joint of the foot involve much earlier to the joint involvement in the hands. Also, few studies do not take into account the the joints in the foot, and they only evaluate 5 joints, that is Ramris 5 evaluation of the wrist or of the hand. Now, synovitis is the hallmark finding in rheumatoid arthritis in the first 2 months of symptoms. Also, if we are using color Doppler, power Doppler imaging should be done as it is more sensitive to the hyperemia in the diffuse synovial thickening. Erosions can be better seen on MRI and CT than ultrasound. However, ultrasound remains a very useful modality to look for the discontinuity in the cortex. We will definitely encourage everybody to read the below mentioned article to know more about the recent developments in imaging in rheumatoid arthritis. Now, the points to be mentioned during any rheumatoid arthritis patient evaluation is synovitis, bone marrow edema or osteitis in the bone, tenosynovitis or tendon rupture, erosions of the bone, and joint space narrowing. Now, among all the points mentioned above, the synovitis, bone marrow edema or osteitis, and tenosynovitis, they represents the inflammatory load or inflammatory markers of the rheumatoid arthritis. On the other hand, erosions and joint space narrowing represent more of structural markers. Now, it has been seen that erosions in the joint space narrowing usually represents the cumulative load of the disease in a patient. However, the synovitis, osteitis, and tenosynovitis represents the present load, or they are the surrogate markers of the inflammatory disease happening in the whole body in rheumatoid arthritis. Contrast-enhanced MRI is the most sensitive modality to differentiate osteitis from bone edema and effusion from synovitis or tenosynovitis. Hence, in newer studies, it is recommended that contrast-enhanced MRI should be performed at least in active patients of rheumatoid arthritis. Also, it is the most sensitive modality to identify and grade erosions, which indicate focal bone destruction and reflect cumulative changes in RA. Now, there are various theories which represent these erosions. It could be outside in theory, that is, that the patient had synovitis, it involved the bone, and then there was erosion. Or there is an inside out theory in which the articular margin of the bone is not involved. However, there was osteitis, which led to bone erosion. There are various rheumatoid arthritis MRI scoring systems, that is RAMRIS scoring system worksheets you can find on the internet, or you can make your own scoring sheet. This we will explain in next rheumatoid arthritis case, when we will be discussing the MRI of the rheumatoid arthritis patient. Also, there are various scoring sheets which take into account the joint space narrowing as per the outcome measures in rheumatoid arthritis clinical trials, that is OMRACT scoring. So this much for today. Thank you very much.